The best way to shift to value-based care is to recognize you can't do it all at once. So pick certain areas, and whether you want to move to a bundled type payment or a capitated arrangement or a partial capitation, go ahead and pick some areas, start there, make sure that those work the way you want and get the outcomes you expect, and then go ahead and expand that kind of a program into a broader sector of the healthcare economy. With the regional differences you have here in Brazil, you really have to analyze each community separately and say to yourself, maybe it's more important for us to focus on some of the social determinants of health and look at programs there, as well as how do we provide basic access to all of our citizens. And do we need to look at instead of saying we're going to solve problems in the cardiac area or in the diabetes area, how about first solving primary care healthcare access for your citizens, and once again take that as an approach to build upon. In the United States, value-based care is being implemented in a lot of different ways, and it really is sort of a test of a number of different models. So recently, Medicare, the Center for Medicare and Medicaid Services, announced that they're going to do bundled payments for knees and hips. It's a new approach, and we'll see how that goes. In other places, you're seeing communities come together, like with the Blue Zones projects or the Way to Wellville or the Clinton Health Matters Initiative, which are these broad public-private partnerships looking at healthcare. And then you're seeing provider groups form more integrated networks and tackle or attempt to tackle specific problems with a certain chronic disease, say diabetes or heart failure, or a different approach. So there are a lot of different ways organizations, the government, and the private sector are looking at value-based care and how do we create these communities of health, culture of health, and improve the overall outcomes for our citizens. Incentives are a difficult topic because they've been shown to create or begin that process of engagement, but there's not a lot of research to show that over the longer term the use of incentives creates outcomes. So what you have to do is create, as others are trying to do, a culture of health, an environment where what we do about our own health becomes just a natural part of how we live our lives. So it becomes natural to go up the stairs instead of taking the elevator, or you have a place to walk or exercise, or access to these healthier foods. So incentives can be used and have their place, but they're only a piece of it, and they're certainly not a panacea that will solve the problem.
LENC, o elo sustentável da cadeia de valor da saúde.